Do you know if you have high blood cholesterol? Do you know what it can do to your health, especially to your heart? Left untreated, high cholesterol can cause serious life-threatening conditions and complications. So stay with us today to learn how you are your first line of defense. We'll discuss some prevention methods, treatment options, and cholesterol-lowering products that can keep you in good health. That's all coming up on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone, and thanks so much for joining us. I'm Jane Hansen. We have all heard and know that having high cholesterol is bad for us, but do we know exactly what it's doing to our body? Joining us today to discuss this topic is Dr. Andrew Kaplan, the pharmacy supervisor at St. Catherine of Siena Medical Center. Thanks so much for being here today.
Oh, thanks for having me, Jane. It's a lot of fun.
So everybody's talking about HDL and LDL and what's the difference and what do they mean and what's the problem? In a nutshell, what is it?
There's a lot of confusion because these terms get thrown around a lot. Good cholesterol, bad cholesterol. I hear my cholesterol is high. I have to lower my cholesterol. There's cholesterol in my diet. Let me help look this out for you. Cholesterol is a natural compound produced by every animal and every plant. You need cholesterol to support all functions in the body. Every cell in your body has the cell membrane that surrounds it that keeps everything inside. That cell membrane is made from cholesterol. All the hormones in your body, testosterone or estrogen if you're male or female, these are all formed from cholesterol. All the nerves in your body that connect the information from your brain to your heart, to your kidneys, to your lungs, needs cholesterol to line it up properly. A world without cholesterol would be a very difficult world indeed. The body would not be able to work properly at all.
So the problem then is not having cholesterol, it's having too much of it in the wrong place.
Too much of it in the wrong place or the wrong kind. So this is where the good cholesterol and the bad cholesterol come into play. So we've probably heard these terms LDL or low density lipoprotein. This is the so-called bad cholesterol. And then HDL or high density lipoprotein. This is the good cholesterol. They have two different and very distinct functions in the body. Their original function is to transport cholesterol throughout the body to get the cholesterol to the places it needs, to the kidneys, to the heart, to the liver, to perform these important bodily functions. But they have slightly different ways of doing it that can lead to difficulties. The LDL, or the bad cholesterol, unfortunately, when it gets oxidized, what can happen is it can go and get stuck inside the arteries of the body. So the arteries are these blood vessels that go away from the heart and transport life-giving blood and oxygen throughout the body. The LDL, or bad cholesterol, can actually get inside of these arteries and form a hole. This way, it decreases the ability for the blood to flow through.
And that can lead to all kinds of bad things.
Unfortunately, yes. We see heart attacks, we see strokes, we see kidney problems, we see peripheral vascular disease. If these arteries that are affected by the bad cholesterol in the legs, a patient may be able to lose function in the feet, may get an amputation, unfortunately.
So the thing, though, about cholesterol, having too much of the low or lousy LDL, the thing about it is the symptoms can be really hard. It's hard to determine until you're actually there, correct?
Oh, absolutely. If you have a high LDL, you may not know it until it's too late. That's why it's very important to have regular follow-up with your primary care doctor to get a laboratory test to determine what the LDL is.
Speaking of which, let's get the first line of defense then against the cholesterol is probably dietary, but secondly, it's really about taking some sort of a drug.
First line for sure is dietary, and that's always the case. I think we'll have a dietitian on a little later today, and he can certainly talk more about some of the components of that. The thing about cholesterol, which a lot of people probably don't know, is that from our diet, from plants and animals that we're intaking, you get about 300 milligrams of dietary cholesterol. This is how much we're getting when we get the butter, when we get a piece of bacon, when we get a plant-based product, around 300 milligrams of cholesterol we get from the diet. The body can produce 1,000 milligrams of cholesterol. So the diet is the most important thing, because if we don't want to get somebody on a medication unless they absolutely have to.
Right, but these medications are easy to take. There's many different dosages, a few side effects. So just talk quickly about this whole statin family.
Oh, absolutely. The statins are the most potent and now the most common medications that we use to treat high cholesterol. And they attack that larger portion. Remember we said 300 milligrams is from the diet, 1,000 milligrams produced by the body. The statin can reduce that 1,000 milligrams that gets produced. The statin is very effective and very potent at reducing the body's ability to make the cholesterol in the first place. And there are now many, many statin drugs on the market. You may have heard of torvastatin, rosuvastatin, lovastatin, simvastatin. These are Crestor, Zocor, Lipitor,
we've heard
the
of
brand
them all.
names.
But at the end of the day, some of them, I mean, not everyone can take them, and sometimes there's bad side effects like...
The most common side effects that we hear in clinic or in the pharmacy or even in the hospital are patients will complain a little bit about muscle pain. Muscle pain is the most common. Maybe 10 to 20% of people will experience some muscle pains when they take a statin medication. The first thing I should mention, well over 90% of people who get a muscle pain while taking a statin, there's nothing to really worry about. It's nothing, the muscle isn't breaking down, there isn't some serious problem. It's usually just some pain caused by the statin itself. And there are a number of strategies that we can do. We can look at someone's iron levels, which sometimes are a little low. Especially now in the winter time, the vitamin D levels can be a little low. We don't get as much exposure to the sun like we're supposed to. So the vitamin D can be low. And even something, the thyroid levels, what's called hypothyroidism, oftentimes very similar to high cholesterol. You could have a low thyroid level and never know about it until your doctor gets a blood test.
Wow, it's a little complicated. You got to make sure you get on board with your doctor and getting the best possible care for all of this. But like I said, this is the first one line of defense, and we're going to talk about many more in this program. Thank you so much, Dr. Kaplan, for being with us today.
Thank you, Jane. My pleasure.
Really appreciate it. And we have to take another break, but don't go anywhere because there is more CHS Presents Lifestyles at the Heart of Health right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. Joining me now is Dr. Thomas Pappas, the director of the Cardiac Catheterization Lab at St. Francis Hospital. Welcome. So good to have you here.
Great to be here. Thank you.
Catheterization is really the same phrase or the same procedure as an angiogram, correct? Because I've heard about that, but I haven't so much heard. Okay.
That's correct.
Now, we've been talking about the first line of defense for cholesterol. And fighting cholesterol was, of course, diet and possibly drugs. Now somebody has to come to see you for a real physical treatment. How do they know when they need to come to you?
Well, first of all, the goal is not to get to me.
Right.
So by the time they come to me, usually they've either developed some symptoms suggesting there may be some blockage has gotten really beyond the point of what medical treatment can do. Or they fail a stress test where they may see their internist or their cardiologist who may perform a stress test because of some symptoms or some unusual symptoms or from a family history perhaps. And the stresses may show an abnormality, which would suggest that further evaluation is warranted, which is when they wind up in my office.
Well, when we look at this, you've got this picture kind of here of the arteries, and this is normal, and they come to you when it gets to kind of here, perhaps?
Right. This is a normal artery up top. The second model here is a little bit of plaque beginning to develop inside the artery, but not obstructing the flow of blood. Symptoms develop when the blockage becomes more significant, when it's narrowing the artery by approximately 70% or more. That's when you expect to have some symptoms, and that's usually what alerts people to the problem.
And the bottom is where you're actually having a heart attack.
Yeah,
so
you don't want to get to the bottom.
You don't want to get there. Okay, let's talk about this process then, this catheterization process.
Right.
How does it work?
It's an inpatient procedure, done as an outpatient but in a hospital setting, where patients come into the hospital and we advance a catheter or a tube through an artery of the body. It can be an artery in the wrist, it can be an artery in the groin area, which allows us access into the central system, and we pass a tube up into the heart. And once we're up in the heart, we can actually advance it into the arteries of the heart, and we squirt dye directly into the arteries.
Okay, so I know you have pictures of what a normal heart looks like. In a normal heart, what do you see?
Well, the first model, the first picture you can see, there's first we inject the dye into an artery, and you can see two of the branches of the heart. And the next model actually shows a nice, beautiful, normal artery. This is called the left anterior descending artery, which is the most important artery of the heart.
And so when you see that, you're happy. That's fine.
If everyone had these arteries, we'd all be very happy. Yes.
Okay, but then what happens when you see blockage?
If someone has symptoms that sound like they may have blockage, it usually means that there's a blockage of 70% or more in the artery. Actually, the next video after this one will show a blockage inside the artery, and you can see that there's a narrowing in the early part of the artery, which was not present on the normal one, which we saw a second ago. That is about a 70% blockage inside the artery, and that's the type of blockage that would create symptoms.
Okay, so now when you have that kind of blockage, what do you do?
Well, what you'd like to do is in some cases, if it's not an important artery, if it's a minor artery, you may just treat it with medication. But in the artery that we have in our video here, it's a very important artery, and this artery needs to be fixed. So the next in the next video will show a wire advancing through the artery, and over that wire we slide a stent, which is mounted on a balloon, and then the stent is inflated inside the artery, and that allows the artery to open up, and the stent helps to keep the artery open, hopefully permanently.
Yeah. And again, this is an in procedure. You do it at St. Francis all the time.
Correct.
We're looking at a slide now that almost looks like a drill. Is it almost like cleaning the plaque out?
Yeah, in some cases the artery is very simple to fix, where you just inflate a balloon, opens up the stent inside the artery, and you're finished. Other cases, the plaque may be there for many, many years, may have a lot of calcium deposit. Calcium is kind of like concrete, and it's not so easy as to just inflate a balloon inside the concrete.
Ooh.
So we resort to a drill-like device. This is one of several drills that we have. This is called rotational atherectomy, where it's a diamond bits on this drill, rotates at a very rapid speed through the artery and helps to open up a channel, and then we go back and put the stent in.
Now, is that how pain? I mean, obviously the patient is knocked out, but is there a recovery process after that? Because it sounds painful and long.
Honestly, it looks worse than it is. You may feel some discomfort in the chest as we're working, but really, it's really not a painful procedure. And for the most part, it's very straightforward, and patients tolerate it very well.
So obviously the point of all of this is saving people before they actually get to a heart attack, as we've shown in the bottom of this little display here. But I want to go back out into the field now. We did send a crew out to the St. Francis Hospital South Bay Cardiovascular Outpatient Facility to take a look firsthand at the broad range of expertise in the diagnosis, treatment, and prevention of all kinds of heart disease that are offered there. Let's go take a look.
I'm Dr. Larry Altschul. I'm Chief of Cardiology at Good Samaritan Hospital, and I am also one of the medical directors of my private practice, which is South Bay Cardiovascular. We are an extension of St. Francis Hospital, so in essence we represent St. Francis Hospital in Western Suffolk. We are a full-service practice, and we are a large group. We have 17 cardiologists, which include interventionalists, electrophysiologists, non-invasive cardiologists, nuclear cardiologists. So we really do treat the full spectrum of coronary artery disease. Now that St. Francis has extended their surgical program to Good Samaritan Hospital to bring their cutting-edge surgical technique to our community, in fact, our patients can be treated throughout the whole cardiovascular continuum, from risk factor modification right through the development, if they do, of coronary artery disease, heart attacks, stenting, bypass surgery, cardiac rehabilitation, and of course their long-term follow-up and prevention after they're discharged.
I felt I needed a cardiologist for my health, because I didn't have that specialty, and someone to monitor my cholesterol, etc. And so I came here and was seeing Dr. Altschul, and I felt very comfortable. He monitored my medications, my cholesterol, and made some good suggestions. But there was one dramatic experience which I think ended up saving my life, and I think St. Francis, Dr. Altschul really made a contribution. I didn't have any cardiac symptoms. Actually, my health was pretty good, except that I was being monitored regularly for cholesterol. I was on cholesterol medications, which was working for me. My HDL was good, et cetera, et cetera. So I was coming and I was seeing the doctor regularly, but at one point, unexpectedly, I was developing severe symptoms, and eventually got to this place, and they immediately took care of it. Instead of sending me to the hospital, they provided whatever services I needed medically, because it was I was in an acute stage, potentially getting a real heart attack. So anyway, that was one of the experiences. The nurses were excellent. And since that time, I've been coming regularly, and I'm stabilized. I'm on a AFib medication called Xarelto, and so far so good.
I've been with Milt when he's been having his follow-up checks, and I found Dr. Altschul so very clear. The way he explained his condition and the medication and what he should do. And we were always very impressed with that.
I felt very comfortable. Never seemed to be in a hurry. I always said to him, I have 2 or 3 questions, and whatever I asked, he answered. And business, professional, and yet very personal.
It's very important for us that the patients understand their disease, the mechanism, the pathophysiology, also their drugs, what the drugs do, what are the real side effects that are potentially there, which are dangerous, which are not. Patient compliance is a big problem out there. A lot of people are afraid of medications because of what they read or hear. But it's important for us to educate our patient as well, because an educated patient is a patient that is more likely to take care of themselves properly and live longer.
I lost my twin brother. I was one of a twin, and my older brother and my father to heart attacks. And undoubtedly there were cholesterol issues which they were not aware of, and didn't have the medication and the follow-up that we have, like with Dr. Altschul and the other cardiologists here today. And that helps us stay alive to a nice older age.
And of course, that's just one part of this huge heart care service that's being offered by Catholic Health Services, St. Francis, of course, being at the helm of it all. With the amount of care and practice and investment that you've made, what do you think the impact is at in patients here on Long Island and all over the metropolitan area?
Well, you know, St. Francis for years has been the premier heart center on Long Island, and I think one of the best in the state, if not the country. And the care we give patients from the second they walk into the hospital till months after their open heart surgery in the rehab programs has been second to none. I think Suffolk County has been underserved, and I think it's a part of the country that needs a good cardiac program. I think South Bay has certainly taken the lead in that regard. And I think opening up an open heart surgery program in Suffolk County, I think, is key to the patients and the population of Suffolk County.
And Good Samaritan is involved in all of that as well.
Right. We've branched out to Good Samaritan. It's a program which is really was opened by St. Francis, Good Samaritan, and hopefully we'll have the same success and same outcomes that we've been fortunate to have. But it's not just the surgery. I think what it is once you open a program such as this, the education involved and the bringing the patients into the system, patients who wouldn't even think about their hearts, I think now have a different focus. I think that alone is going to make a tremendous impact on the healthcare in Suffolk County.
And really help prevent heart disease,
Correct.
Which would be what you're all aiming for in the first place.
Of course.
Yeah. Dr. Thomas Pipus, thank you so much for being with us today. Really, really appreciate all of your insights.
Thank you, Jane.
So we have to take a break, but our discussion continues with nutrition tips to keep your cholesterol in check right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. I'm here with Gerard Murray, a dietitian from Good Samaritan Hospital. Of course, we've been talking all about cholesterol. That's right. And you are the guy that's at the very front of the battle against it with talking about what we put into our body and how that affects us. Yes. So diet and cholesterol.
Okay.
How can it help?
Well, diet actually can help keep our arteries healthy. And that's one of the most important things, because when our artery, the inside of our arteries gets irritated or injured, then plaque development is encouraged. So diet is the main way to maintain healthy arteries.
So give me great examples of what we should eat.
Okay, plenty of fruits and vegetables, lean meats, whole grains,
Fishes?
fish.
I mean, is it all about the omegas?
Omega-3s, which are in fish, various fishes, nuts. Also, unsaturated fats, so that would be nuts, seeds, also various vegetable oils, canola, olive, sunflower, safflower.
So you look for the unsaturated fats when you're looking at the oils and that sort of thing. And then what about dairy products?
Well, dairy products can be a very high source of saturated fat. So obviously when you're looking at dairy products, you want to go with a lower fat dairy product.
You know, we all talk about these great diets and talk about here's what we should have, lean meats, et cetera, but then when you want to go out to eat,
Right.
or you want some food that doesn't cost a lot of money, or you might go to a fast food place, they are loaded with the foods that we should not eat for our heart.
Yes.
What do you do?
Well, you have to, depending on the situation, you know, you're going to have to make the best choice that you can. Sometimes, you know, it's not going to be ideal, but in that situation, you have to try to make the best choice. Most places, restaurants, even fast food restaurants, they have salad bars. They have things that you can order that are plainer or are not supersized. And that would be your best bet, is to just go with the simpler things.
One of the things I've been noticing lately is now that they're putting calories on everything, I'm shocked at how many calories are in something. And sometimes it's about the sauce.
Yes.
So can sauces be really
Absolutely,
bad?
absolutely. And that's why it's good to ask for sauces on the side a lot of times when you can, because then you can control how much goes in there.
Okay. So you also talk about it's just as important what you don't eat as what you do eat. So when you're calculating on a daily basis, what should you look for? How should you say, this is what I need to have today? Are there certain requirements almost?
Well, for example, fruits and vegetables, I usually tell people a minimum of 5 servings a day.
5 servings of
Yes.
together,
yes.
fruits and vegetables.
Total combined.
Okay.
Yes. Yes. Dairy products is usually, and this is just a very rough estimate, but
Sure.
dairy products usually 2 servings a day. You know, there's another way of doing it too. You can look at, they have what they call My Plate, and that will provide you.
That's like an app?
Yeah, no, it's actually just a way of picturing your dinner plate or your lunch plate, how it should be in terms of what foods you should be eating. So half the plate should be fruits and vegetables, then the other half is divided in 2, and one half of that should be protein, and the other half of that should be your grain or carbohydrate.
So if you had 2 messages that you wanted the audience to take away today from this whole idea of diet, what would it be?
Well, one is when you're making changes, don't try to change your entire diet overnight. Start with the simplest things first, then work on the harder things. Slow and steady really gets you permanent results. And then the other thing would be, don't focus on a specific nutrient. Focus on your overall dietary pattern.
And if you have good eating, it's a good way to a healthy heart, and avoiding doing some of the other things we've talked about
That's
today.
right.
So,
Yes.
and I'm sure that becomes very important in education, that whole education process, which is a lot of what you guys are preaching these days.
Exactly.
So an educated patient is a
healthy patient.
Is a healthy patient.
Yes.
Thank you so much for being here. I'm going to invite Drs. Kaplan and
Thank you,
Pappas to
Jane.
come back and join us. And I'd like to just have last words from all of you. If you could say one thing to the people that are watching out there and concerned about their heart health, what would it be?
I would say listen to Mr. Murray about the diet and do everything you can to avoid coming to me, which would include diet and the exercise, which we really didn't talk enough about.
Yeah, exercise. How much a day?
It should be 30 to 45 minutes per day minimum.
And that's good cardio?
It's great cardio. It's got to be cardio where you get the heart rate up to a certain level, you work up a sweat. It's not walking and doing window shopping. It's actually walking with sneakers on, working and getting a good sweat.
Okay, and last words from you.
If you have been prescribed the medication by your primary care doctor, by your cardiologist, my recommendation is to take it as prescribed. If you have any questions about dietary supplements, over-the-counter medications, or changes or side effects, you can always ask your pharmacist, or you can ask your cardiologist, your primary care physician.
Right, and watch out for some of those supplements too, right?
Sometimes there's some interactions, and it may make the medication you not work as well. It may make the medication you're taking work actually too much.
Boy, we're glad we have experts like you guys around because it can be very complicated and yet so simple.
Yes.
And we all want to be healthy. I really appreciate all of your insights today. Thank you so much.
Thank you.
For more information or to schedule an appointment with Catholic Health Services, simply call 1-855-CHS-4500 or you can visit chsli.org. Thank you so much for joining us today. I'm Jane Hanson, wishing you goodbye and good health.